Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer and founder of Atlantic Coast Aesthetics. And Dr. Pane, this question comes in from Miami, Florida, from our Facebook page. And the question is, would I benefit from a mommy makeover? And I know the person sent in a couple of pictures. So Dr. Pane, why don't you describe the situation and let us know the best way to go here?
Yeah, it was a great question. The person said that they aren't too concerned with their breasts, but were interested in seeing what could be done there. They have one child and said that the backside got kind of flat and saggy, and that the skin, the belly, they use the term have dead skin on the belly. That really isn't quite the case, but I know what you mean. You mean saggy, kind of loose skin. When we look at the pictures, actually very good candidate overall for this procedure. Now, a couple of questions to be answered. Are there any more kids interested in your future? If there are, sometimes it's better to put things off, because when we do these procedures, we want to make you look as good as we can, and we want that result to last as long as possible. If you go on and have other kids, you're going to be changing things to some degree. Now, you can actually do it, and it doesn't work out. It doesn't mean you'll need something done in the future, but I do caution people because things will change. Here, the question is, if the priority is to do the backside, as I was mentioning about getting the bottom better shape, I would recommend a liposuction fat transfer and do that first. Now, keeping in mind that you don't do that, we don't typically do that with breast procedures or a tummy tuck in Florida, because you can get into trouble when you do too much surgery at one time. And for that reason, Florida has some specific rules, because I think we're leaders in cosmetic surgery nationally. There's been more issues where those rules have come up, and we follow them and we're safe. We don't have any big problems here, but I would tell people we would do that liposuction fat transfer first if that's the priority area, and we would see how things are looking for the abdomen later. Now, that abdomen is probably going to benefit from a tummy tuck later, at which time that could be done with the breast procedure. You can do that at one sitting. Sometimes if the priority is to do just a limited amount of fat transfer around the side, that even with the breasts and the tummy tuck at the same time. So there's not a guarantee that we would do two surgeries here, but I would lean more toward it depending on what you were looking for. So again, in most cases, liposuction fat transfer first, then down the line, probably a straight breast aug here. I don't think a lift was needed, and an abdominoplasty based on the way that skin was looking. So likely two procedures, possibly one, depending on the specific situation. So hope that helps.
Well, thank you, Dr. Pane. And if you have a question for the doctor, please visit our Facebook page and website. And Dr. Pane, we appreciate your time, and we'll see you on the next question.
Great.